trust is such an important element in any relationship. And the doctor-patient relationship is no exception to this rule. And you know, I was at the College of Medicine South Africa graduation 2 weeks ago, and Prof. Almi Miller delivered a beautiful speech, an oration speech there. And she was talking about trust. I mean, she layered this. She spoke about all the different layers. The trust between the doctor and the patient, the trust between a doctor and other, people, or let me say team members of the medical team. And she was speaking about, trust, being vulnerable and open as a health professional. But today I want to talk to you here on the Dr. Tebz Diaries about trust between the patient and the doctor. I remember I had a patient who needed an operation on the eyelid. The baby needed an operation on the eyelid. So obviously the parent brought the child to me. And so I assessed the child, I spoke to the parents, I explained exactly what I was going to do in the procedure. I mean, word for word, step by step, in a manner in which they understood the complications, the possible complications, the possible outcome, what the post-op journey or post-operative journey would entail. I explained this, outlined it clearly, and I got this sense. I mean, she brought the whole entire family. It was her parents-in-law, I'll never forget, her husband, and I explained to all four of them. And so, I went to bed, and I was so unsettled in my spirit about this. And so the next morning, the mother is bringing the child to theater. The mother is brought with the child to theater, and she is crying. She is beside herself in tears. I mean, wow. I stood there in front of her and I said, Mama, believe you me, I will not take this personally. If you do not trust me, I as a doctor do not feel comfortable going forward with this operation, because if there is a complication that is going to happen in the surgery that could have happened in anybody's hands, not because it's my hands. It was going to happen even if the best of the best surgeons was going to operate your child. And this thing happens. You are going to blame me. You're going to say, it is you, doctor. And so I said to her, look, I won't take it personally. I will literally write you a referral letter to this other professor I know, to my professor whom I know down the street. And I'm sure he'll be more than happy to operate, because I, as a doctor, understand that unless you trust me, I can't do my work. It is so important, as a patient, to recognize and acknowledge this aspect of a relationship. If you as a patient do not believe in your doctor, you do not trust your doctor, you have every right to say, I don't feel comfortable, doc, working with you. I don't. Do you know anyone else? There's nothing wrong saying that. It's like me having a banker. If I don't trust my banker's advice when he or she is telling me that, look, there's this new product, if you invest in it, you'll get so much interest, back, and so forth and so forth for you, and all of that, intricacies of finances. I'm a doctor, please do not judge. Or, I don't trust, then I'm not going to take that person's advice to heart. I'm going to just be very dismissive of whatever they say. But if I know this person and I trust this person, when they advise me to say, you know what, put your money in this and that, and so forth and so forth, then I'll be able to walk a journey with this person. You must understand that no matter how short or no matter how long a patient-doctor relationship is, it needs to be founded on trust. And best you believe, any doctor will not take offense to you saying, I don't feel comfortable. Any doctor. And even when, for example, you have traveled a journey with your doctor and you feel like the relationship is no longer what it was before, or you are not getting any joy out of this situation, you still have every right to say, doctor, you know what? Yeah, I hear what you're saying, and we've walked this journey. You've tried this, you've tried that, and we are not getting anywhere. Is there anybody else who you can refer me to, whom I can get a second opinion? And if that doctor doesn't feel comfortable giving you a second opinion, a name, then you're more than welcome to go look for your own second opinion. And you're more than welcome, and you're allowed to ask your previous doctor for your medical notes and go with your notes to another doctor. Those notes belong to you. The information in those notes belong to you. The actual hard copy may not belong to you physically. For example, in government, the notes of a patient actually belong to the patient, but the patient can request to say, may I please have a copy of my patient notes? You can do that. But what I'm saying is that you have every right to go look for somebody else to help you and to assist you. There's nothing wrong with that, A patient has rights. You have rights as a patient, and one of those rights is to seek medical attention from someone whom you feel comfortable with. I mean, yes, when you're in a public setting, in a public hospital, in a public clinic, the doctor who you are with is a doctor who you are with. There's nothing you can do about that. But if you're in private, I mean, you can go to Dr. A here, and then you can decide to go to Dr. B or C in another province, in another country. I mean, it's your money, it's your time. You have those resources. You're at liberty to do so. So, it is so important that we don't underestimate that element of trust. And, to all my junior doctors who are listening to me, I want you to know that you must always assess if that element is there. And there's nothing wrong with you saying to a patient, you know what, I think you don't trust me. And that is okay. That is okay. Because if you don't trust me, I'm more than happy to refer you to someone else. There's nothing wrong with that. It's like a boyfriend-girlfriend relationship. Once you stop trusting your partner, it's time to let go. It's time to break up. It's time to move on. Why stay in a relationship that's not working? I never in all my life thought I would equate a doctor-patient relationship to a romantic relationship, but that's me for you. Okay, yes, the other element about trust that's important is that if you don't trust your doctor, you won't believe what they say. You won't believe in the treatments that they give you. You'll be very skeptical about everything that they say. You'll be looking and be like, okay, I'm going to take the treatment, but if it doesn't work or it gives me adverse effect, I'm going to sort you out with my lawyers, because that trust is not there. That's the problem. There are factors that affect whether a person trusts their doctor or not. Last week, we spoke about expectations. So if a doctor cannot meet your expectation, then you are more hesitant to trust them. You're more, doubting. You start doubting. Am I in the right place? Especially if you are very close-minded and don't want to hear anything else except what you want to hear, then you are going to not trust your doctor. So that's the first factor. The second factor is about the setting. There are many people who don't trust their doctor because they're in a government setting. So already it's like you're in a government setting. So government hospitals, facilities, already people are skeptical that, the service is subpar. It's not as on the same level as private. Some people believe that private doctors are better than government doctors. For some reason, there's this notion or belief. I don't know where people get it, because you'll find that the same doctors who are in private are actually working in government. The only difference is that the resources that are made available to them to treat and manage their patients are different, because government, obviously may not have exactly the same amount of money as private, So anyways, some people believe that. I have actually had a patient, the color of your skin and your gender. Some people believe that male doctors are better than females. It's an old notion, but some people do believe that. I once had a patient who did not trust me because I was black. They actually wanted to be treated by an Indian doctor whom I was working with, but that Indian doctor was actually a junior doctor. They literally were like, no. And best to believe it, this patient was black. I'm not talking about a patient of a different race. I am talking about a patient who's the same color as me, but would not trust me because I was black. It happens. And so when she explained that, no, actually, she's the senior doctor and she's the one with the skill to operate you. She will do it. I did it, and the operation went very well, and the patient was very happy. And I can't remember if he apologized or didn't, but I didn't take offense because people are humans. People are people, you know. Not that I condone racism, but I was just like, wow. It's the belief the patient had, you know. I mean, there's many instances where I had a patient walk in. I'm standing there as the senior doctor, and I have a white male doctor as my junior doctor, and they're talking to them. And this is a white patient talking to a white patient, but would not trust me, but trusted my junior more than me because of the color of my skin. And until my junior doctor, and I leave them. I leave them. I leave the patients when they do that because I'm like, I don't have to explain myself and I don't have to prove myself to anybody. So then the junior doctor then turns to me and says, Tebz, we know this patient wants 1, 2, 3. So what do you think we should do? What must I do? And then the patient obviously realizes that, oh, she's the senior doctor. He's the junior doctor. She's the one that's actually going to operate on me. And then you see the face turn red as a beetroot. Not even a tomato, a beetroot. And then I'm like, oh my word. And I leave it because people are people, and we're all informed by our background and experiences. And we all have underlying prejudices that we're unaware of. And I myself recognize this, so I don't take it personally. And then I turn and I say, okay, so do this and this and this. And then I turn and I say, okay, ma'am or sir, so this is what we're going to do for you, 1, 2, 3. And I explain to them very courteously, very, politely, and we go forth and the relationship is formed and we continue. And voila, Bob's your uncle. Because I believe that it is by experience that you can change a person's perspective. So through that experience, I believe that I have helped someone to gain a better perspective of this situation so that they don't do it next time and they don't judge someone by their color, and having said that, color does not equal excellence. It doesn't. Racial color, culture does not equal excellence. I have met black people who are terrible doctors. I've met black people who are wonderful, excellent doctors. I've met white people who are terrible doctors, white people who are excellent doctors, Indians, coloreds, the same. I have met them and it is there. So I'm just going to throw it out there. So don't trust someone just because of their color or their age, because it's independent of that. Each person needs to be, accepted and taken on their own merit. Yes. So that's the other factor about trust. Color. And then the other thing that also builds trust is just time. Time, it plays a factor. Experience plays a factor. As you journey with a person, they may start out as very skeptical, but as they continue, then they gain trust. They come to believe you. They come to trust you. And so trust is built, So sometimes trust is there from the get-go. Sometimes it has to be earned. And it's okay. Either way, we are doctors and we're here to help. So that's one of the things I wanted to mention about trust. So I think it's very important that we are we are cognizant of this fact that trust is in a relationship and we need to acknowledge it. Yeah, about owning it. Own trust. Own it. Yeah, and say it. I trust you or I don't trust you. And then continue from there. So thank you so much for joining me on this episode of Dr. Tebz Diaries. So until next time, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.